All right, welcome to the National Telehealth latest presentation in the National Telehealth Resource Center's webinar series, providing timely information and demonstrations to support and guide the development of your telehealth program, presented on the third Thursday of each month. Located throughout the country, the 12 regional telehealth resource centers, supported by 2 national resource centers, serve as focal points for advancing the effective use of telehealth and supporting access to telehealth and services in rural and underserved communities. Today's presentation, Calming a Nervous System, Managing Rural Spinal Cord and Brain Injury Patients Through Technology, is presented by Jeff Pinto, Clinical Services Manager at Triumph in the Center for Distance Health. The Center for Distance Health is a division of the University of Arkansas for Medical Sciences. And Jeff, we're going to throw it to you.
All right, let me get my screen up here. Okay, can you see that?
Looks good.
Okay, great. Okay, so like Aaron said, my name is Jeff. Can you hear me okay? Maybe?
Yes.
Okay,
Yeah.
Great. Okay, I just want to make sure. I turned my microphone off for a second, but I want to make sure that was back on. All right, so like Aaron said, my name is Jeff Pinto. I'm a BSN Clinical Service Manager for the Triumph program here at UAMS Center for Distance Health. That's in Arkansas, Little Rock, Arkansas. Triumph stands for Telerehabilitation Interventions through University-Based Medicine for Prevention and Health. And it's a telemedicine program. It's new. When I first heard of it, I wasn't sure what to think about it. Some background on me: I'm a BSN, so I've done patient care in the past. I did around 6 years with rehab patients who were spinal cord injury patients, and so when they came to me, they said they were developing a telemedicine program for spinal cord injury patients, and I wasn't sure what to think about that. I had a hard time wrapping my mind around it. But the more I've working with those type of patients, working with spinal cord injury patients and with brain injury patients, and seeing just how hard it is with them in the hospital, and knowing the struggles that they have and they have to face once they get home, I knew that they needed something. Their family need resources, the patients need resources, community needs resources. And so the more I learned about this program, the more I realized that this could be a great resource for patients and families throughout the state of Arkansas, especially in the rural areas of the state. And so I got really excited about it. And so today I hope that I can lay it out and make sense for everybody what we're doing with the program and how we're helping people throughout the state right now with the program, and make sense of it all. Objectives for today: I'm hoping that you'll be able to just understand the need for the program through the information I have, and understand the areas of the program, the key areas of the program that we developed and that we're implementing throughout the state, and then as well as just be able to understand how it's assisting and helping those people throughout the state in those areas. So Triumph, the mission for Triumph, like I say, this program was developed. It's still new. It was developed last year in February in 2014 for the state of Arkansas. It was done by it's funded by a grant through the Arkansas Trauma Rehab Program and the Arkansas Spinal Cord Commission. And so what we're doing is providing call center access for on-the-spot triage for consultation. We're also enhancing the quality of life and increasing available resources for the patients and family and rural providers throughout the state. And stimulating healthcare system cost savings through efficient round-the-clock, evidence-based mode of care delivery. And this is a big deal, and I'll talk more about the savings and quality of life savings that we're helping that are helping out with this program, because especially for spinal cord injury patients, and I think for most traumatic brain injury patients also, traveling and having access to resources is a big burden on them and their families, and I think also people in the community, because I know at heart, whenever you get into the healthcare profession, you want to help people. That's your goal, and so you want to do whatever you can to help people. And I think sometimes these people reintegrate into their community and come out of the hospitals, and the people in the communities want to help, but they just don't know where to go and where to turn. So this is a good way that we're doing this through helping out with this using this program and the savings that's allowing. So I've talked a little bit about Arkansas rural area. And some people may ask, especially when I first started, I was thinking, why do we need telemedicine? I think we see patients just fine. We do well. And Arkansas is the natural state. Lots of beautiful landscapes, lots of wide open spaces. There's some places in Arkansas where you can live and have lots of land and not have a neighbor or a store for miles out, 3 to 10 miles out, which can be really nice. But when you have needs, when you require certain things and you need things to be easy to access, that's when telemedicine can really come into play. That's when it can really save the day. And so with these people who are in these areas of the state that are more rural, that are further out, this has really been a great thing for them, knowing that they could just pick up the phone and call someone, or they could go to one of the local clinics and do a telemedicine video follow-up appointment with the specialists here at UAMS. So right now, just giving some background information on the need throughout the state. Nationwide, there's around 12,000 new spinal cord injuries patients every year, which is it's a small number compared to the amount of population, but that's really a lot of people for spinal cord injuries. And this is something that no one wakes up in the morning and plans to have a spinal cord injury or a traumatic brain injury. So this is a life-changing event for these 12,000 people that happens to. In Arkansas right now, according to our Spinal Cord Commission, we have 2,476 patients, around that number. And those are the patients that have registered on the spinal cord registry. There are patients there are people out there who have not registered. Maybe they're from out of state, or maybe they just don't know about the Spinal Cord Commission. And so there's more people, but as far as registered, that's the number we have on file. And then a lot of these people are living outside of metropolitan areas of Arkansas. So we do have quite a few around the central location where they can have access and come into the hospitals a lot easier, a lot more easily and frequently. But there's several people throughout the state that don't have that ease of access. So this is a map of the state per county, or all the counties of Arkansas. And I put this out there because a lot of times, especially when I go out and talk to people throughout the state, I'll mention to them about spinal cord injuries and traumatic brain injuries, and they may not see these people from day to day. They may not work with these clients. And so just to give them perspective of what's in their area, I like to show them this map, and so they can see how many people we have on file in their county. And a lot of times they're really surprised. Of course, you can see in the middle of the state, Pulaski County. That's where I am located, in Little Rock, which is the capital of Arkansas. And we do have a lot of resources here, so there's a large population of spinal cord injury patients, as well as in the far northwestern corner of the state. Those are up-and-coming areas, bigger metropolitan areas, and so they have a lot of people up there with spinal cord injuries and traumatic brain injuries because there are more resources in that area. But as you can see throughout the rest of the state, there's still quite a bit of people around, and these are people that need help just like the rest of them, are looking for resources and encouragement in their own areas. Some background on TBI patients. So this is a national number from the CDC. They're a little old, but I think it still gives a good point of where we're at with just the whole number. From between 2002 2006, 52,000 deaths, 275,000 hospitalizations, over 1 million people that visited the emergency departments with traumatic brain injury. And sometimes when someone has a brain injury, sometimes it's very severe and sometimes it's just a mild brain injury or even a concussion. So, we've heard a lot about concussions lately, football players and kids that sustain a concussion and then they can, go back home and they even can go back out and play after a short amount of time. So, those are one type of brain injuries, but then the other ones that are more severe, that are more involved, those are the ones that they need consistent help and they need resources to help them and help their families cope with the changes that are occurring in their lives. And this is another map of the state of Arkansas, and this is focused on traumatic brain injuries throughout the state. So these are per capita numbers. So per 100,000 population. So it's, and I like to use this again just because it gives a visual to people who are either working in the area or not in the area from outside the state, just to see, this is what we have. These are the kind of population amounts that we have in our state and in certain areas of the state. And so it is important. There may be one county that has a zero. I think I see one county down there at the bottom with a zero, but the rest of the counties of the state do have some population of traumatic brain injury. And like I say, remember the center of the state is a more populated or a more metropolitan area in the northwestern portion of the state. The rest of it is lots of rural, lots of land, and lots of need for a helping hand, some resources, and so that's where we step in with Triumph. Da, da, da. So these are the areas that we're focused on with Triumph. Like I say, it's a resource to serve patients 24 hours a day, 7 days a week that have had spinal cord injury or traumatic brain injury, or their families, or even the providers in their areas. Because what we want to do is we want to help providers also, feel confident in treating these patients. There's a lot of times and a lot of providers that I've talked to that, they would rather just send the patient from an area that's maybe at the top of the state to an area to Little Rock, which may be a 3-hour drive, but they feel more like they are doing the patient a better service by sending them somewhere to people that are more familiar with what's going on with them. And so what we want to do is allow them to feel more confident and give them resources, education, a call center to call, and other resources they can use to feel more confident. Keep the patients local in their area, be the heroes of their area by taking care of those patients and not just shipping them off. So like I say, the call center, emergency department consults, telemedicine consults, and education. And I'll go through these individually as we go through the presentation. So real quick, the call center, a lot of times people ask me how it works and what it looks like. And so I tried to kind of give a diagram here of what usually happens in the call center. Like I say, it's a 24-hour day, 7-day-a-week call center. So they can call at any time with any kind of question or concern. I know sometimes when people think call center, they think you have to have some kind of major occurrence happening. to even make the call. But that's not true. We want people to call that are just curious about the call center, that may have just a question about their disease process or just anything else that we could possibly help them out with. And so usually the patient or their family member or healthcare provider would call, and they would get connected to a nurse, and the nurse would assist them to the best of their ability. We have a protocol on the computers as well that help the nurses with questions to ask the patient to really hone in on what's going on with the patient at that time of need, if they're calling for a concern. And if it does get to the point where it's beyond the nurse's scope of practice, then it will get shifted over to one of the doctors. And that's that nice gentleman there with the sucker in his hand. And at that point, they'll determine whether, it's something that the doctor will determine whether it's something that can be managed at home. And we hope that it is. And if it's not, then the patient will need to seek further treatment through the nearest emergency department. And one of the benefits of the call center is that we're trying to make it to where patients, the issues that these patients have can be managed at home, because there are a lot of things that patients go into the emergency room for that they didn't really need to in the first place. They could have been managed at home with just a little more knowledge or a little more help in the situation, and could have prevented the travel to the emergency room, the costs of the emergency room, and all the other burdens that come with that. There's a story that I remember right now. There was a patient that had taken care of in the hospital, and the patient had went home, and he wasn't home for like maybe a day or two, and ended up back in the emergency room. When we were caring for him in the hospital, he always had this complaint of this band of pressure around his chest, and we were familiar with that as a neuropathy, a nerve type, not a pain, because it wasn't a pain, but it was the pressure, and it was around his injury site. And I should tell you, it was a spinal cord injury patient, and so it was around his chest area, higher up, and so this happened again at home. And when this happened, he went into the emergency room because he was scared of what it was. The emergency room worked him up for cardiac. They didn't see any signs of any type of cardiac complications or anything to be wary of, but he still complained of this band around his chest. They went ahead and admitted the patient to the hospital. He stayed as an inpatient for 3 days until one of the nurses on the floor just said, well, let's call over to the rehab, because this patient just left rehab, and see if they know anything. And so when they did, we talked with him, and we told him that, yes, this is just a neuropathy. He has this is common, and he needs this neuropathy medicine that he should have been taking. Well, he hadn't been taking that medicine. And so all that to say, if there could have been somewhere in that line a call made, or someone knew about a resource that they could call and reach out to and get those questions answered, this patient may not have had to go to the ER, or they may not have had to be admitted to the hospital for 3 days for observation. But that's one of the benefits of the call center, is that patients and families can reach out before they go into that long, drawn out process. So like I say, the patients have access to medical information, family members as well have access to the call center. They can call, and this is a big help for families, because they can't ask those questions or that they're concerned about, issues that they may be dealing with. Their loved one may be dealing with spasticity, or maybe if they're traumatic brain injury, they may be having spasticity, they may be having some fatigue, extreme fatigue, or sleep disturbances. And so the nurses at the call center can give them, remind them of things that they need to do for the patient, and that the patient may not be doing at home, and it may be, causing them to have spasms or have these sleep disturbances. Healthcare providers as well. We want to make sure that healthcare providers around the state know about the program, are aware of it. When they do have these patients come into their facilities, they're able to care for these patients even better than they would have normally, because they have a resource. They can check in with people to see, what's going, to ask those questions about what's happening with the patient that's in their facility, especially when it's something that's not common to them. If the patient's having a lot of spasms and the healthcare provider at that facility is not really familiar with what causes that or why that may be happening, then they can call and get some insight on what to do for that patient. And then, like I said before, this just keeps the patient from having to make the long journey to get the same exact treatment they could get there and go back home. And then same as the healthcare providers with physicians. And physicians, like I say, if a physician calls the call center, then of course they're going to get directly referred to or directed to a physician through the call center. So it's going to be a physician-to-physician type phone call. And so that way the rural physician or the distant physician can discuss whatever it may be that they need or the questions they may have with another physician. And that would be one of the specialists, either the traumatic brain injury specialist or the spinal cord injury specialist that's involved with the program here at UAMS. So another awesome thing that we do with this program is telemedicine follow-ups. And what this does, this is huge benefit to patients because this allows them to do these follow-ups that they would normally do from anywhere from 3 to 6 months, except it keeps them from having to travel so much, and it keeps the family members from having to take off so much from work. It helps to prevent any kind of health risks like bladder dysfunction or bowel issues or sores that can occur. And that may not make sense to most people, but people who are having to deal with or that have worked with spinal cord injury patients or traumatic brain injury patients know that those are main issues when it comes to their care and management. There's certain things that need to be done with their bowels and certain things that need to be done with their bladders. And it's kind of a scheduled thing throughout the day. And so when you take long trips, that makes it a little more difficult for the patient to stay on those schedules. And as well as sores, because when you're dealing with a patient who can't feel below a certain point, and I don't know if you've ever sat in the living room and just watch TV on the floor and you sit there for an hour, you get up and you're like, wow, I can't feel my butt anymore. That's kind of what they're going through, except the longer you sit and the more that numbness sets in, the more there is a decrease of blood flow to the tissue. And I'm sure most people understand that leads to pressure sores and skin breakdown. And so those are the kind of things we want to prevent, and we can do that by just decreasing that travel time. And like I say, it allows the patient to get connected with the provider, and so they can determine whether the patient needs to come to Little Rock for procedures or to be admitted into rehab. Sometimes these patients haven't been to rehab in a long time, and they can be readmitted for some further evaluation and further therapy that they may need. And then also for families and healthcare professionals in the area that they're in, their local area, it allows them to get to know those people. It allows the healthcare providers in their local area to get to know them and vice versa, and build that rapport for those patients and their families. And this is a picture of kind of what our setup looks like. I've got a bigger one in a minute. So the regional clinics right now, this is where most of the patients will go, because like I said earlier, telemedicine is still kind of a growing field. So not all clinicians have telemedicine equipment in their offices. At some point, hopefully they will, and that'll make it even easier on the patients and their families to just go to their general practitioner to see a specialist in the follow-up clinic, and then they can have their their GP right there alongside them while they're doing the whole follow-up appointment, and that just helps build those rapport again, and helps that physician, that local physician, for them to better understand what's going on. But these are regional clinics, and as you can see, pretty much anywhere in the state, if a patient, wherever a patient may be, it's almost always a 30 to 40 minute drive for them, which is a big difference because, if a patient is up here around Harrison and or there's another area that's pretty populated called Mountain Home, this can be a 3.5 hour drive just to get down to Little Rock to do a 15 to 20 minute follow-up appointment. And that's mostly what these patients will do because they're doing fine. They're at home, they're doing fine. They may need some changes to their medications or a few other adjustments in other places, but 15, 20 minutes, and then they're on their way back doing another 3.5 to 4 hour drive. And like I said before, that can really put a burden on the patient, on the family, family's work schedules, and just the quality of life of having to go through that for the whole day. And the other thing is that some people, if they need special equipment, if they're in special wheelchairs, if they're a traumatic brain injury that has a special wheelchair, or a spinal cord injury with a special wheelchair, they're going to have a special vehicle to make those journeys. So if they don't have that, then there they are again at another loss. And what do? And so they being able to go to a closer area, usually the families can figure out a way to make that happen a lot easier than making a long journey happen. So this is a picture of our older setup. It's an older picture, but this is the basis of what it is. This is our spinal cord injury specialist, Dr. Kaiser. And so what he'll do is he'll see the patient. This patient, I believe, was in Fayetteville, so that was further up north. And he'll see the patient and basically just do a clinic. Just ask the patient how they've been, if they've had any issues, any problems that have come about, anything going on with their medications. And then, the patient can see them just fine. And pretty much everyone that we've had do this has really enjoyed this because it has saved them a lot of time. They feel like their questions and their concerns were answered through doing the telemedicine this way, through doing their clinic this way. And so I think a lot of that too is just being able to have the rest of the day to themselves and not, having that day just eaten up with time and travel. So, emergency department support. So this allows patients throughout the state who do need to go to the emergency rooms to have a number to call to give to those healthcare providers in their local areas so that they can be managed. So whatever may be happening to them can be managed more efficiently and more effectively by those healthcare providers in their local areas. And again, this helps build that rapport with those healthcare providers in those areas too, at those hospitals. Also, there's video equipment in many of the emergency departments here in Arkansas. So if the need is there, that the patient has to be visualized by the specialist here in Little Rock, then they can do that as well. And this makes me think of another story that I just recently heard from a female spinal cord injury patient. She had had her injury for a long period of time, so she was doing well at home, managing most of her daily activities. And occasionally, spinal cord injury patients will have this thing called autonomic dysreflexia. And so it's a very life-threatening event that can occur. That can cause patients to have, it can cause people to have strokes because their blood pressure gets so high. And it's usually due to some type of painful stimulus in an area that they just can't feel. And sometimes it can be from bladder, maybe their bladder's overfilled, maybe they're constipated, maybe they're sitting on something. And what it reminds me of, or the best way to kind of paint the picture for you would be if you've ever taken a long car ride and you had to go to the bathroom, but you just couldn't, and you start sweating and you just feel like you're gonna explode. That's kind of how they feel. They start to sweat. They may start spasming a little bit. Their blood pressure elevates very quickly, and so it has to be the painful stimulus or whatever's happening to the body needs to be located immediately. So, okay, so that's out of the way. Now, back to the story. So the female patient had this occur, and she knew what it was. She did everything that she thought was appropriate, and it still didn't help. So she called 911. They came and got her. And she even had a little card that kind of explained, like I just did, about what it was that she felt she was having and what she was going through. And also what happens sometimes is these patients will get a headache because their blood pressure starts to rise. And so when the paramedics came, she explained what was going on. She gave the paramedic a card, and the paramedic on their way to the emergency room called it in as a migraine headache. And so this right then, the female patient was very distressed because she was afraid that they were going to treat it as a migraine, that they weren't going to give her the proper treatment. And so again, she tried to relay the message, and again, he called it in as this migraine headache that she continues to complain about. She did eventually get them on track with what was going on, and they did solve what was happening before it got out of hand. But it's those kind of situations that we want people to call in for to get the help and get the more efficient treatment plan for traumatic brain injury patients and spinal cord injury patients. We can be of service there and help those patients get what they need and get back home. And speaking of the emergency department, so these are a lot of the trauma centers throughout the state that have audio and visual equipment. And I think this map has probably been updated since I got it, but this is the one that I received. And so you can see a lot of areas throughout the state have emergency rooms with audio visual equipment. So they could be, if they did have a need for the patient to be visualized, then the patient could be visualized by the specialist. Provider education. This is the last rung of Triumph, the education, but it is the most important for what we're doing, because we want to make sure that providers locally and distant are educated well on how to manage traumatic brain injury patients and spinal cord injury patients. We want to make sure that they feel confident when they have a patient come in. And if they aren't confident, then they know where to go and the guidelines to look for and look at, and to learn more about what their patient, especially for these patients who, they've had this injury occur. They went to the hospitals, they've got the medical treatment they needed, and then they go back to their rural communities, or their local communities, and their general practice physicians may not be ready for that. They may not feel real confident about, this patient that they've known for many years now has these new onset of symptoms and disease process. And so what we're doing is the residents in the physical medicine and rehab program, along with their attendings, their physiatrists, which are the spinal cord injury specialists and the traumatic brain injury specialists, are working together to write guidelines for management of traumatic brain injury patients and spinal cord injury patients, and just their everyday things that may occur are the most common things that can occur for these patients. And that way, the healthcare providers and physicians and more people can be educated on what these things are and what to look for, and how to help. Another thing that we've started this year is Operation Outreach, and this is a big education series that we're doing with through the funding through the Craig H. Nielsen Foundation. This is being done through the Arkansas Spinal Cord Foundation as well, and we're helping educate just very aggressively the rural areas of Arkansas on spinal cord injury education, and we're gonna be doing webinars for spinal cord injury management, and developing curriculum to share with the schools, and even some curriculum for the med school here, to just get them to get these future doctors more of a heads up on how to manage this population, because it will become more prevalent. The more people that get out and drive and do crazy things, it's real easy to get these spinal cord injuries. And then, as well as Learn on Demand, so we do, through this program, we do webinars called Cap Talks, and these can be found on Learn on Demand. They're usually we'll do 4 to 6 Cap Talks a year. We usually do them in the spring, and it's once a month. So we'll do it live, and then we'll archive the video for later viewing, and those archives are usually on Learn on Demand. So it's anyone can sign up for Learn on Demand, and these videos are free because we want to make sure that this education gets out and is easy to obtain by everyone in the state. There are some videos on the Learn on Demand website that do require payment and fee for, but the good thing about these videos is that it does allow healthcare providers to obtain CEUs. So that's the biggest benefit. You get an hour CEU for going through the video. So that's very cool. Okay, and so there's some references. There's some contact information. All right, so that is the end of the show. Any questions or any comments on anything? All right.
Well, it doesn't sound like we have any questions at this point. We had some interesting banter going on in the chat screen, talking about how wonderful the Triumph program has been for our area, and how Terry Imus mentioned how it was identified that things like the autonomic dysreflexia issues that we're having were one of the reasons that this program was spurred. So is there anything else that you can tell us that has been particularly difficult or a barrier for getting the rural providers to buy into this process?
Well, right now it's more of just awareness. So there, it's getting the information out to the providers is probably the biggest barrier, just because there are so many providers in the state of Arkansas, and there are a lot of them in rural areas. So just figuring out ways to really be efficient with getting the word out without spending a lot of time and money doing that. And I think once the physicians understand what the program can really do and the benefits that it really has, I think more and more physicians will utilize it. But it's just getting the information to them and allowing them to know about it. And for them, it allows them to keep that patient there in their office. It's actually benefiting them. Anyone who uses the program that can keep the patient in their facility, it's going to be a bigger benefit to them, because they get to treat the patient and they get to provide the care, and they get to build that relationship with the patient instead of just sending the patient away. Because that can be very embarrassing for a patient to have to, they think they can rely on somebody or somebody in the community, and then they just get asked to go somewhere else. That's never a positive thing for people. And I'm not saying everyone. I think there are a lot of great healthcare providers and professionals in the state of Arkansas, but I do know that, and I have talked to some that they just don't feel as confident, and they want to do what's best for the patient. So they do ask them to go to one of the bigger facilities. And sometimes they'll go, it depends on what part of the state they're in also. Sometimes they're, closer to the Oklahoma border, so they'll send them over to one of the bigger facilities in Oklahoma. Sometimes they're in Missouri, closer to Missouri. Sometimes they're closer to Memphis. So it depends on where they're at, where they might go. So they don't always just come to Little Rock for treatment either.
Do you think this is a program that could be duplicated anywhere else, any other state? And if so, what would be their first steps?
Okay. Sure. Yeah. This program could easily be duplicated from state to state, and I think the first step is just allowing people to know that there are people in their area that care, that understand what they're going through, and they care about what they're going through, and they understand the disease process very well. And so setting up education clinics, or setting up a call center is a little more involved, but if you can get some people to volunteer to take call, then that would be amazing also, because that way the families and the patients could have a number they could reach out to at any time. And a lot of times things happen, it always seemed like working in a hospital, things either happened on the weekend or in the middle of the night. And for a lot of places, a lot of like clinics or general practitioner offices, things like that, those places aren't open at those hours, or at least not all those hours, maybe some hours on the weekend. But so, when you have an event like that happen, you want to be able to have the easiest and quickest access you can. And so yeah, I mean, if there's people who are willing to carry their phone around with them and hand out a number and just say, hey, call me if you have anything. But like I say, education is probably the biggest aspect of that too, and just educating their local areas about what to do and how to manage people that have had spinal cord injuries or traumatic brain injuries.
Well, I want to thank you so much for taking the time to tell us all about your program. It was a wonderful talk. I'm going to go ahead and have you click off, and I'm going to share my screen, and we're going to wrap up. But we all appreciate your time, Jeff.
Well, thanks. I appreciate everyone allowing me to present on this. I'm real passionate about this. I've just, the more I learn about what this can offer to people, the more excited I get about the program. So I appreciate that.
Wonderful. Okay. All right, can you guys see my screen now?
Got it.
Okay, fantastic. So this presentation has been a part of the National Telehealth Resource Center webinar series, where we bring you timely information and demonstrations to support and guide the development of your telehealth program. The next telehealth webinar is going to be Thursday, July 16th at 1 p.m. Central Time. It's going to be sponsored by the Center for Connected Health Policy, and Dr. Richard Garifin is a PhD from University of California, San Diego, and his talk is going to be on using telehealth technology to monitor tuberculosis treatment adherence. We do want your opinion of this webinar. It's very valuable to us, and your participation in a brief survey is needed. So please go to the website link on your screen, and it would be greatly appreciated. We look forward to hearing your ideas for topics in the future, and we appreciate your attendance. Y'all have a wonderful day.